Mr. Chairman. Secretary Becerra, it's good to see you. Welcome back virtually to the committee. I don't really need to describe my district to you. You're very familiar with it. But as you know, the district is a very complex district. It has the haves and it has the have-nots. It has people from all walks of life, from different backgrounds, using different languages, getting around by different means. And during the pandemic, we saw the impact of COVID-19 on the community that I represent, that was disproportionate compared to other communities. First saw that in the data, as you probably were aware, that a lot of the COVID-19 tests were not taking place on the east side of Los Angeles, but on the west side. You saw it on the infection rates. You saw it on the death rates. I'm proud that we've been able to turn the page, but I believe it was foreseeable. And our policymakers and our institutions and our programs just, for some reason, froze when it needed to turn quickly and pivot towards a more equitable solution. We did that, and I'm proud that California now has the lowest infection rate of any state in the country. But equity is key, but it's very hard to do, very hard to do. No matter how much money you use, it's all about how you invest, how you target, and how you implement. And it's not always a straight line. And I like equity because it can impact so many different people from so many different areas. And it impacts people of color, but it also impacts working class, whites, and rural areas as well. So I know the Health and Human Services budget focuses on advancing equity and reducing health disparities in all healthcare programs. Can you briefly describe these programs and their intended goals? And also, how will you ensure these programs work in practice?
Congressman, first, great to see you. I see that those digs look really familiar to me. That office of yours. So I hope you're taking good care of not just the office and your workers, but the district as well, since you've been able to come in and do a phenomenal job as the member of Congress for that district after I left.
Yeah, somebody left me some nice furniture when I took over.
Amen. Well, let me tell you that, by the way, thank you for all your work on equity and trying to make sure that all communities are served. As you said, our district, my former district, your current district, it's a tale of two cities in many ways, right? From wealth to poverty, but folks working together in many ways. I will tell you that President Biden has spoken not just about equity, but he's made it clear he wants to see results. And so at HHS, it's easy for me as a secretary to now say, we're going to demand results as well from the people and the programs that we have at Health and Human Services. One of the things that we're doing, I have a couple of quick examples, the emphasis and the investment of real money into dealing with maternal mortality and morbidity. We can take for granted in the richest nation in the world that we have access to healthcare, but you go to some communities and there are women who are dying as a result of their pregnancy, and the women who are having terrible outcomes as a result of the pregnancy. And it should surprise no one to know that happens mostly in communities of color. And so there are things that we're trying to do to address that. The investment that the president, and I could follow up, but I apologize. I see the time has expired.
Finish the thought, Mr. Secretary.
Just going to mention Indian Health Services, the kind of investment that's being made in Indian Health Services. We're going to make sure that we're out there reaching folks who, for the most part, have been in the shadows or in the corners of America. Thank you.
Thank the gentleman. Let me